Hi everyone, welcome to Case-Based Tree. I believe this is your third case-based course in the series, and I am very excited to work with all of you. I haven't met everyone yet in the class so far, except maybe if you are being advised by me, if you're my advisee, but I am very excited to work with everybody this semester, especially to help you guide you through a series of cases that we will be working through the semester, and also helping you to develop your clinical skills further. So this orientation, I'll focus more specifically on what are some changes of the course structure in comparison to your previous case-based courses, and also laying out some expectations, and we'll sort of briefly navigate through the case-based tree course Canvas site. As you have known from your previous case-based course, case-based is not a lecture-based course. It is a discussion. So the expectation is for you as the students or as the participants to participate, engage, and contribute to the discussions. Your facilitator is going to be there to guide you with questions, or guide you, direct you to the right directions of the case workup, or like other follow-up questions. But ultimately, it's going to be you who is going to be talked and discussed a lot more in the class. So the class designed for case-based tree is going to be a little bit different from what you have experienced in previous case-based course. So for case-based tree, we instead of having weekly discussion sessions, we are just going to have every other week case discussions. So in total for the semester, we'll have a total of 6 sessions plus one OSCE at the end of the semester as a final. The reason being we do it this way is because we noticed that during the rapid workup, you guys are a little bit stressed out, and and to really digest a case and work through a case, especially as a beginner, it takes a lot more time. So that's why we designed this course to provide you and allow you a lot more opportunities and time to really digest the topics, digest the clinical skills that you need to develop to be a better pharmacist. So the weeks are going to be divided into week A and B. So week A is the preparation time. That's when I will release the case and an activity called out of the box questions on week A. So you'll get those case, you work it up, you have some time to digest the materials, and you will submit a full written SOAP note and also a OOB responses to the questions the midnight before each of the discussion sessions. So please note that this deadline is before the discussion sessions, okay? And in this way, you have a lot more time to prepare for the case instead of just like 1 hour. So during the sessions, like I mentioned, there's only going to be 6 sessions during the semester. It's going to be 1.5 hour discussions, again, because we give you the preparation time the week before. We have the luxury of extending the discussion hour from like 1 hour to 1.5 hours. We received some feedback from previous students mentioning that 1 hour is just too tight to really discuss the case in details. So that's why we're extending the discussion hours. And the time is going to be 1:30 to 3 for section 1 to 7, and 3 to 4:30 for section 8 to 14. For each sessions, some students will be assigned to present their problem, like you have been going through in the past case-based series. I believe case-based 2, that's how you do it, right? Like you would, few selected students, 2 to 3 students will be selected to present the main problem. And then this time around, I'm adding another activities before you get to discuss the case in more comprehensively with your facilitator. It's the out-of-the-box questions where there are more in-depth questions. It's it's not just a simple what is the adverse events for this drugs, what alternative you can do for this case. It's more in-depth where you have to do a little bit dig deeper in terms of reading the guidelines. There will be a lot more practical questions, such as like, okay, counsel this patient, pretend your facilitator is the patient, how would you counsel it specifically? So it's a lot more clinical skills that you will be developing for this activities. And there will be about 5 to 7 students per session who will be selected to answer or to respond to the OOB questions. And again, OOB questions will be released as well with the case. So you will have time to sort of work through the questions, and you're expected to submit the OOB responses as well with the written SOAP every single discussions prior to discussions. For the case, and then after you go through the problem presentation, you go through the OOB questions, then you will continue with discussing the full cases more comprehensively with your facilitators. And this is where you will earn your RX round credit. And all students, including those who presents for the main problem or the OOB questions, will be expected to contribute and still engage with the discussions. And then lastly, there will be final OSCE, like I mentioned. And the format of it, like you will have to present one main problem, and there's also one OOB question that you'll respond to. So it's going to be pretty similar to how the live discussions would be in terms of, those who get selected to present. It's just that there's no discussion afterwards. Schedule is to be announced, and you'll have a little bit more details in the syllabus in terms of dates and time, but more details will be released once we get closer to the final. And similarly, the case will be released 1 week prior to the OSCE, and you're also expected to submit a full SOAP note with the OOB questions responses by midnight before the OSCE day. So this is just sort of like the timeline that I kind of mentioned a little bit earlier in terms of, the live discussion. So the first 15 minutes, you'll sort of do the SOAP presentations. Please take note that you are, for the individual SOAP presentations, each presenter will be allowed 5 minutes maximum each, and there's a point for that in the rubric for this oral SOAP presentation. I forgot to mention earlier, there will be, since we have 6 discussion sessions, there will be 6 cases. So the first cases is going to be group presentation, and case 2 to 6 is going to be individual presentation. So the first case, since it's a group presentation, the group members can work with each other, and you guys are going to just submit the group case together, while the case 2 to 6 is going to be individual work. So make sure you don't copy paste or work together for case 2 to 6. And so like I mentioned earlier, for the discussions, you'll have about like 15 minutes for some presentation, and then there will be about like 20-30 minutes to kind of go through the OOB questions for selected students. And the rest of the time, 30, sometimes like 40 minutes even, you'll kind of do the comprehensive discussion of the cases, where the facilitators will have a lot more clinical questions for you guys to participate. So now let's talk about expectation for the classes. There's a few expectations that I expect from each of the students. So first of all is attendance. Because we only have 6 sessions for the course, I can't afford anybody to miss, more than one, and also it has to be excused absence. So excused absence means there's emergency situations, and please let me know as much as advanced as you can. Directly email to me, like the email that I mentioned, I jot down in the the cover page of this PowerPoint, and also email your facilitator as well, so they're aware, if they're going to expect you or not in the class. But for sure, email me as soon as possible if you do have emergency situations. And a lot of those excuse absence with emergency situation will require documentations to be approved. For unexcused absence, if your absence if not permitted, it will result in 0 for all activities that are assigned for you. So first of all, the RX rounds, you are going to miss that. And if you do get assigned to present a SOAP presentation, then it's going to be 0 for that day. So again, attendance is expected for every single discussion sessions. The second expectation is that I expect everybody to participate fully. As I mentioned, this is a discussion-based course, and RX rounds, to earn the RX rounds, you have to participate and contribute meaningfully to the discussions. Participate means like you're not just participating once, out of like multiple different times you can participate, participate throughout the whole discussions. Contribution means like you're not just saying, answering yes or no, you're actually contributing more, explain, your answers, explain how you get to your plan, like what other things that you're thinking about, or maybe even, like you might have follow-up questions that, you might not have been able to figure out before, like either your facilitators can't answer it, or, they will sort of give those questions to me and I can go through them in the debrief after the sessions. So again, participate, contribute to the discussions. Professionalisms, I expect everybody to be professional. One, I expect you guys to wear professional attire. Dress like as if you're going to your IPI or API, so dress shirt, dresses if you're, female, work pants, closed-toe shoes. So just be professional, right? Just how you see it in the pharmacy setting. Do your own work. Plagiarism is never tolerated. Please, 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 please follow this honor code. I've had a few students in my previous case-based course before who did copy paste, and they think that I might not find it out, but I do. So please do not plagiarize. If it's individual work, please do it on your own. It's okay for you guys to discuss it, with your friends, but again, like all your work should be your own work. Like you shouldn't be copy pasting the document that your friends are submitting in Canvas, right? Like, for example, if you're gonna, sure, like the SNO, a lot of those gonna be similar, with you and your classmate, but your assessment and plan should somewhat be different, right? So again, just don't plagiarize, okay? And the consequences is that you will get 0 for your work. Your RX rounds, if you're going to present on that day, you're going to get 0. So please, 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 I really regard professionalism highly. And, the earlier you get to be professional in your pharmacy career, the better you're going to be, like later on, once you are really in the pharmacy setting. I've seen a lot of students who behave unprofessionally, and it has really affected their career. Pharmacy is not small. People talk, people know each other. So make sure that you always behave professionally at all times in front, when you work in the pharmacy setting, just because it can really impact your career. I've seen examples where some students don't get the employment that they wanted because of some unprofessional issues. So again, I can't really emphasize it as much anymore. Again, it starts early. your professionalism. Don't wait until you get to a pharmacy practice setting to be professional. All right. And like I mentioned earlier, if you violate any of this expectation, you will get 0 for your RX round. Don't be late for your discussions. If you don't complete or submit your assignments, if you plagiarize, if you are unprofessional during discussions, observed by your facilitators, if you have evidence of content sharing, then again, you will have for sure 0 for RX round. And if you plagiarize, it may affect your also presentation if you're presenting that day. So the other expectation is the case workup. A lot of students cite lecture notes for their case workup. They don't read guidelines. Even if they mention the guidelines, they don't read it. They only list it just because they have to. So please read the guidelines. Do not rely on your lecture notes. It's sometimes it has the right information, right? But sometimes some informations get updated very quickly in the guidelines. So that's why you don't fully rely on your lecture notes. When you go to a practice setting and then you need to back up your recommendations to a doctor or to patients, you cannot say that, if they ask you like, where did you get your information from? You cannot say it's from lecture notes, it's from Dr. So-and-so. It has to be from a valid resources like guidelines where it's public and it's available for everybody. Up to date, sure, it can be a starting point, but again, up to date also might not be as up to date. Sometimes the guideline will get updated and up to date may not be updated as quickly as that part. So always go straight to the guidelines. Sometimes up to date might miss some of the information that are available in the guidelines. They might not mention it in their site. So again, always go to the guideline. If you're contesting your grade and you don't have any backup from the guidelines or valid resources, then it will not be accepted. And when you work up your case, be comprehensive, right? Like, for example, diabetes, you guys probably have done that a lot in case-based care. It's not just managing their glucose, right? It's also managing and preventing complications like cardiovascular disease, hypertension. All of those are, examples of comprehensive workup for each problem. If you feel like some things are related, even if it might not be the treatment for a problem, but sometimes it might interact with treatment plan for that problem, then you have to be comprehensive. It has to be part of your plan for that specific problem, right? Like a lot of doctor interaction, for example, right? Think bigger picture, consider all the problems. So sometimes, other comorbidities might affect your treatment plan, right? Like, for example, you might have renal impairment, it might not be, part of your diabetes, right? But you have to renally adjust the dose, right? Because otherwise you're going to harm the patients if you overdose them. For example, that's, again, think bigger picture. There are going to be a lot of patient factors that are in the case, and you have to pay attention to those details so that you can provide a very optimized plan for the patient. So if you probably have experience from case-based care, the majority of the grading for the SOAP are going to be in your assessment, plan, and your rationals. Those are going to be about 75% of your grade for oral presentations. So make sure you focus on them as much as possible. A lot of times I see students, oh my God, they list all the S&O in their, they list pages of S&O for each of the problem. It's not going to be your focus. Your focus is going to be the assessment, plan, and rationals. Your S&O is going to be just 10% of your the whole SOAP grading. So again, focus on your assessment, plan, rationals. For the assessment, do not copy paste the HPI or like the subjective, right? It's about like, what do you think the control of the medication, right? Are they controlled currently with the problem? Are the current treatment plan appropriate, or the dose, comments on those, right? Not just copy pasting your SNO. For the plan, it needs to be full and complete. It needs to have the medication name, the strength, the dose, the interval, and if you're recommending a as needed or PRN medication, then you must have indications or parameters when the medication should be administered. And sometimes durations should be applicable as well for some treatment plan. Rationals is also a big part of the SOAP. When you mention why you're giving recommendations, think further than just, oh, because the guidelines say so. Why did the guideline recommend it, right? There is a reason why did the guideline endorse that recommendations. Look more into like what outcomes, what benefit does the treatment plan can lead to that the guideline recommended, right? Or what other patient factors, maybe like the patient doesn't fit the general population that's recommended by the guidelines. There are other patient factors that might fit some other recommendation, right? For example, I mentioned it down there. So again, it's an adequate way to say like, because the guidelines say so is your rationale. Look deeper into the why. So another assessment that you'll be having this time around, this is new, is Pharmacy Practice Performance, or P3, we abbreviated. And this is going to be based on your OOB questions. Again, I was kind of referring to it a little bit further before. So it focuses on your clinical applications. It will also assess your communication, the way you deliver those responses, and then your therapeutic knowledge. And questions may include to like, maybe the patients was being given treatments before for certain problems. So what's your assessment? Like, do you think you could have done differently to optimize the treatment? Anticipating some responses or outcomes from the treatment that you might be giving. Questions, drug information that you might see a lot in the clinical setting. Pharmacist run tests or services, like a lot of this is going to be your pharmacokinetics, anticoagulation, antimicrobial stewardship. Those are going to be pharmacist run. Basically, pharmacists are the one who monitor, who prescribe or read the prescriptions for the patient and follow up with the patients. Assessing lab or workup trends, that can change acutely. For example, like a lot of people who got sick, they'll be hypertensive, right? Because they are sick. But it doesn't mean that you need to start an antihypertensive medication, right? So you just have to kind of monitor the trend to really determine if they really need to be treated, or it's just kind of like an acute changes that will resolve once we resolve the main problem. Assessment plan for a secondary problem, which you should always have in your workup anyway, but I might ask that as one of the OOB questions. And then again, like I mentioned, you might be counseling patients as one of those questions. So this is kind of like the grading breakdown for the semester. You'll have 2 oral presentations during the semester. One is a group presentation, the case 1. Everybody will present as a group. And the second one is going to be individual presentation. And RX rounds, there's going to be 6 discussions. So there will be 6 RX rounds to earn during the semester. And pharmacy practice performance, or P3, like I mentioned, is based on your OOB questions. It's going to be 3 of those during the semester. 2 is, are going to be asked to each of the students between case 2 to case 1 to 6. And the last one is going to be at your final OSCE. And then for your final SOAP presentation, it's going to be a full presentation of one problem, and you're going to provide just the assessment and plan and no SNO. So that's why you see like the 10 points difference from the regular oral SOAP presentations. So you would just focus on the assessment and plan. You have about 5 minutes to present your main problem. And again, this is another reason why you should practice during the first, the first case to like 6 cases during discussions, to make sure you're having the presentation done in like 5 minutes. And also during final OSCE, you will only be allowed one back-to-back notes for your problems, and also one back-to-back notes for the OOB questions. So make sure your written subnote are concise, because you don't have that much space to spend for the final case, the note that you're going to be able to bring in for the final OSCE. And again, you will have to submit your workup and also OOB responses by 12 a.m. on OSCE day. So this is before the OSCE. So let's kind of go to navigate the Canvas a little bit. Let me just show you the Canvas site. All right. So when you go to the course, you will go straight to the homepage. This will have a lot of links and information about the course. I have my email here, course descriptions. You can go to course schedule for the full schedules of the courses, in terms of like when you're needing to submit it, when are discussion dates, and final OSCE as well. And this is the syllabus to the syllabus. And for this course, it will be set up by modules. So the first module going to be your orientation, and I will have like other materials called Pharmacy Toolbox. We'll kind of go over that later on. And then moving forward, it's going to be, case 1 module, case 2 module, and so on until case 6, and the final as well. In case of emergency, please email me and your coordinator and your facilitator as soon as possible, so we can make the arrangement. And this is the course schedule that I mentioned to you about. If you click this link, it will bring you to these schedules here. And I have a legend in terms of what's highlighted, like the orange one are going to be the release of materials, cases, and orientations, and then the green one are going to be your discussion dates and assignment due on the midnight of that date. And then the final is going to be at the end. So the modules, when you click on the modules, again, like I mentioned, the first one going to be orientation. There's going to be Pharmacy Toolbox. This is some guides and success tips from one of the preceptors of Intermedicine, Abby, instructant, that you can kind of review. Protocols. There will be a lot more protocols in here, but for now, there's going to be this for the case 1 first. Each of the protocols, when you click on it, there's going to be a link to a video to give you an overview on what the protocol is all about, and give you a little bit more guidance in terms of how to use it and what to consider while you're sort of managing their anticoagulation, or warfarin or heparin. And like I mentioned, this is the case 1 module. So for every student, you have to complete the orientations first, so which means like you're reviewing the syllabus, you are watching the orientation that I'll post in here as well, and kind of reviewing the call for volunteers for liaisons. For those who are interested, please sign up. You have to complete on all of this materials first before your case 1 will open up. So make sure you go through every single materials there in the orientation setting. So once you, so another link here is going to be your facilitators and discussion rooms. It's going to show you what sessions, who's are the facilitators for each sessions, and also their email, and also where you're going to meet. R107 is going to be at the rotunda, one of the classroom by the side door, and the door should be around the side of the building. And this is how you'll find your session and your group. So you go to the people tabs right here. Once you go there, click on the groups and then just search for your name. For example, let's see, who's the first one in the name here. So Ethan Apes. If you go to groups, search for your name, and then just click enter. And then it will show you the first one. It came out as your group, case one group, and then later on they'll tell you the section. So from the case one group number, you can already tell you're on section 4. And then you can click on this group 4B, and then you can see who else are going to be in your group, and you can kind of communicate with each other to work together for a case 1. And section 1, then you'll go through your facilitators, find your facilitator link to find who is your facilitator, and also your room for the for discussion dates. The next one is Pharmacy Toolbox. It's going to be on the module. I just put it there so that if you need to go straight there, then you can go there. To find the rubrics for each assignment, this is what you can do. So you go to assignments, click on it, and then so this is the Pharmacy Toolbox if you click on it. So this is the assignment link. So for example, if you want to see like what is the RX round rubric, you go to your RX round, and then once you click on it, the rubrics should be shown. And for RX round, there will be 3 different things you'll be assessed for. One, again, active participation. You actively participate equally with your peers throughout the sessions. You provide meaningful contribution. It's not just like one word answer yes or no, but you actually provide explanations, elaborate more, and provide lists if it's going to be like a listing answers, right? Professionalism, very important. You have to dress up professionally, pay attention, and participate during the discussions. Don't get distracted. Don't look at other things. Pay attention, listen, and you'll be good for professionalism. Don't be late to the discussion as well. This is the deduction in terms of when you're going to get 0 for the whole RX points. If you have 0 for professionalism, you automatically get 0 for the whole 20 points of RX points. And this is the other ones that you will be deducted for and again, like deductions are going to be the whole minus 20 points of the RX rounds. Plagiarisms, arriving late, and that's considered as unprofessionalism. Late or incomplete submissions, and also if you get 0 for professionalism, you get 0 for the whole RX point. So make sure you're being professionals. Again, I can't emphasize how I really highly regard professionalism. So that's for RX round. To look for your SOAP presentations, this is the group 1, and this is going to be your individual SOAP presentation. Most of the rubric are going to be the same for group and individual one. The only difference is going to be at the end, and this is going to be quite similar from what you have seen or what you have been assessed to from CB2. You have SNO, assessment, and so on. And then for group presentation, you're going to be assess in terms of how cohesive you are as a group, how collaborative you are, the flow of the presentation, what each member knows what they're doing. So that's the group dynamic that you will be assessed for. Deductions, similar with previous CB3 courses, CB case-based courses like CB2, unnecessary recommendations or other treatment monitoring plan, there's going to be -1 point per action. -5 or -10 for harm. Irreversible is 10, reversible is 5, and then you have to write up a harm essays if you get this point within a week of the grade posted. So always, regularly check your grade and make sure you set your settings so that you get notification in your email when a grade is posted or when a comment is posted. So you have to submit the write-up within 1 week of your grade being posted. Otherwise, you might get a 0 for your overall presentation. And then this is new for case-based tree because we're going to be using protocol. So if you are instructed to use protocol, or some cases require to use protocol and you don't use it in somewhat, then you might get -3 points for not using the protocols. So similarly, individual presentation rubric gonna be the same, except for the end where there's no group dynamic, but instead you'll be assessed for your presentation style in terms of 5 minutes. You need to make sure you are done by 5 minutes. No, not much distractors, and then also your speech are clear, and you have confidence in your presentation. And lastly, for your pharmacy practice performance, and final subnote is going to be the same as your individual presentation in terms of rubric. And for pharmacy practice performance, the P3, again, you're going to be assessed on 3 things. The majority is going to be your clinical applications, basically that, like from the way you respond and the way you get to your answers, you demonstrate critical thinking, appropriate applications, you are looking at the guidelines diligently, you are doing your diligence to really get to your responses, not just citing lecture notes or, not really thinking through the questions or cases. The other ones are going to be, how effective you're communicating it, how reliable, how convincing you are in terms of relaying your messages through your responses. And then the other one is kind of like just accuracy of your response, accuracy of your answers. All right. Again, this is kind of like what you'll be assessed to in terms of critical thinking skills. And then the rest of the links are going to be instructions. If you're are required to write on HAM essays, then this is the instructions. So you'll be in your rubric and rubric and syllabus as well. If you want to refer it to failure to submit it, like I mentioned, you're gonna get deductions. And then lastly, this is the link to sign up to be liaisons for your sections. So please sign up. I would love to work with you. And this is kind of like the commitment. All right. So let's kind of go back to our PowerPoint slide. Let's see here. All right. So like I mentioned, we'll have some additional materials for this time around in CB3, like the protocols, when you're instructed or when it's applicable. And when you work up when you work up the patients, you need to use it, otherwise you'll have point deductions. And again, each protocol will have video overview on how to use the protocols and how to navigate it. And these are the protocols that you may be working with this semester. Just for your information and also additional guides, I made the guides to work out patients, what things to kind of include in your assessment, in your plan. And there's also like the tips to succeed in the course by an API preceptor instructor. Always check your announcement. I typically would provide announcement whenever the case is released, or for a reminder, or any of the news or any other important details that I want you guys to know of. Again, always check your announcement. And again, set your settings so that you'll get emails whenever there's announcement being posted, or comments being posted, or grade being posted. Lastly, again, would love to work with a lot of you guys as liaisons. Commitment is very, very light. I don't want to bombard you, to be a liaison, and to bombard you to have too much work during the course. I know that you guys are very busy already. I just need one liaisons or two, you know, from each facilitator or each section. The commitments, just, you know, be the ears and eyes for your classmates if they have any recommendation or feedback about the class, or even like complaints. You know, you can make it anonymous. You know, you don't have to report to me the name or anything like that. I won't be judgmental. I love getting feedback, and this is how we can make the course better, right, for everybody, not just for you know, the facilitators, but also for the students as well. And just email me, you know, shoot me an email if you have any feedback from your classmate, or even, you know, as you know, if you're not liaisons, just shoot me an email as well for any feedback whenever, anytime during the semester. And for liaisons, again, other than just as needed, you know, reporting, we'll have a midpoint meeting, and it's going to be during a break week on week 7, and it's going to be during class time and going to be in Zoom. So you guys don't have to, you know, come to the class, only just for this meeting. Again, hopefully the commitment's very light, and you can respond to the discussion thread in the orientations. It's going to be in the homepage, the link, and also you can also click it here as well in the orientation slide. All right, and that's kind of it. If you guys have any questions or feedback, comments, or anything like that, feel free to email me. Again, it's going to be on the first slide of this PowerPoint presentation, and it's going to be the easiest way to reach out to me. All right, looking forward to see you guys in class.